Welcome to today's press briefing. We have on the stage two speakers with us, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority. Dr. Zhang will give you an update of COVID cases. Good afternoon. As of last night, we recorded 119 PCR positive cases and 101 RAT positive cases. So altogether, 300 positive cases have been recorded, and so far 1.191879 million positive cases have been recorded, including some 746,000 PCR positive cases and 445,850 RAT positive cases. For the 119 PCR positive cases, 21 were reported by the HA, 16 reported by the Public Health Laboratory Service of the CHP, and 82 reported by private laboratories. Of the 84 positive cases, the Public Health Laboratory Service conducted genome sequencing analysis, and no L452R have been detected. And we have 22 imported cases recorded today, including 16 PCR positive cases and 6 RAT positive cases. 14 involved arrivals from 6 flights yesterday, 1 by CX2819 and 3 via CX865, 1 via CX881, 2 via SQ882, 1 and 1 via SQ895 and 1 via AI311. And there were also 8 arrivals recorded earlier, and their positive cases were identified in the 3rd to 7th specimen. There are no new cases regarding RCGs in schools. Today is a school holiday, and the HA has also reported 5 positive cases. So altogether, the HA has reported 9,026 positive cases, together with 74 cases not reported by the HA. Altogether, 9,100 cases of death have been recorded, including 3,753 females and 5,347 males. The gross fatality rate is 0.76%. I'm not going to repeat the analysis I reported yesterday, as it is similar. Now Dr. Lau will report on the HA situation. Good afternoon. As of now, 1,339 patients are receiving treatment at the public hospitals, North Antar Hospital Infections Control Center, HA the Infectious Control Disease Center, and the AW Treatment Facility. Yesterday, 2 patients were reported in critical conditions, and no new cases in serious condition has been recorded. So far, 5 patients are in ICU receiving treatment. We also reported 5 cases of patients passing away yesterday. That's 3 males, 2 females with age between 53 and 88. Among the death cases recorded yesterday, 1 were from a residential care home, 2 did not have vaccination record, and 3 had 2 jabs. Of the 5 death cases, 4 were elderly citizens above the age of 65, and for the remaining patient, she was a 53-year-old female. She had a DM, and on the 24th of April, she fainted at home, and she bumped her head, and she remained unconscious for about 10 minutes before her son discovered her, and then the ambulance was called, and she was sent to the A&E of United Christian Hospital. Whilst in hospital, she did not have coherent speech, and her right side felt weak. So upon CT scan, hemorrhage, intracranial hemorrhage was found, causing an increase in pressure of her cranial capacity, and she was then referred to the QE hospital for further treatment. During hospital admission screening at QE hospital, she tested COVID-19 positive with a CT value at 34.8. She suffered from ICH whilst in hospital, and different means were explored as treatment plan, but her condition continued to deteriorate, and she passed away at about 7 a.m. in the morning yesterday. 168 patients have recovered as of yesterday, including 112 patients being discharged upon recovery. So far, 48,129 patients have recovered, including 47,281 patients who have been discharged from hospital. Since the beginning of 2020 in Hong Kong, altogether, 60,509 patients have recovered, including 59,661 patients who have been discharged from hospital. And today we have not recorded any patient testing positive via hospital admission screening or in-hospital testing, and no staff or patient has been listed as close contacts. As of staff members, so far 22,503 HA staff have tested positive, and 22,097 members have returned to their posts. The floor is now open. Please use the mic when you speak, and before you speak, please introduce the media organization you represent. This lady over here. I'm from Hong Kong 01. Good afternoon. I have a question for the Department of Health in relation to the care worker arriving in Hong Kong who passed away in the hospital on the 28th of April. Do you have any analysis of this death case? And with a decline in number of confirmed cases, does it mean that the fifth wave is coming to a close? And some mainland experts have suggested that the sixth wave may be hitting us in winter. What is your view? And also, can you tell us the utilization rate of the designated clinics? And there are also long COVID patients who are required to go to another district for medical consultation because of the full booking of the clinics. Will you consider converting some of the designated clinics back to normal clinics? For non-COVID cases, I'm afraid I don't have information. Of course, in terms of the number of confirmed cases, the figure is way lower than the start of the fifth wave, but then there could be a rebound, especially when the social distancing measures are gradually being relaxed. You may recall in the beginning or at the peak of the fifth wave, the designated clinics play a vital role. These designated clinics allowed those in quarantine or confirmed cases staying in the community to receive medical help if necessary. And we also have a hotline set up. As of 5 p.m. on the 27th of April, there are 23 designated clinics under HA providing medical consultation for over 120,800 patients. And among them, 17,000 patients made bookings via the care hotline. They belong to the high-risk groups. We understand that there is a need to reorganize our clinic services, and there may be necessary for some of the patients to visit other clinics or to get the drugs they need. And in light of the current epidemic situation, we will keep in view and readjust our manpower situation, and the services currently suspended will be resumed in due course, and we will also adjust the quotas available at general outpatient clinics. Announcements will be made in due course.
Next question. Any more questions? The gentleman over there. I'm from Mingpao. First question. The Center for Health Protection mentioned different subvariants of the Omicron strain, including BA.2.12, BA.5, etc. To date, how many subvariants have been identified in Hong Kong? By the way things look so far, what's the risk of infection for people and the severity of infection And another question for the imported cases. As the restrictions are relaxed, what's the risk for further infections in the city? Previously, we had imported cases triggering outbreaks in the past. What's the CHP's assessment of the relevant risk? What are some indicators for some possible tightening of the relevant mechanisms in the future? For the hospital authority, the designated clinics, Dr. Lau said there has been demand on services all along, but there are also people suffering from chronic conditions who need to get their medicine at clinics. For these designated clinics, how will things be adjusted down the road? There are also services for those suffering from chronic conditions at other hospitals, etc. There has been demand for such services all along. What's the roadmap like for the gradual resumption of the non-emergency services? For imported cases, we do genome sequencing. We take the specimens and go ahead with the whole genome sequencing. Omicron keeps changing. We will keep an eye on information from the World Health Organization on variants that we should be looking out for. The WHO has been mentioning BA.4, BA.5, and BA.2.12. In terms of imported cases, we have found 2 cases of BA.5. These were mentioned in the past. And then we also found 5 cases of BA.2.12 and 5 cases of BA.2.12. For BA.2.1.2, these are branching off from the BA.2 variant. In terms of clinical characteristics, the patients suffering from these subvariants show little symptoms. The WHO is monitoring the subvariant and the relevant threat. For the 3 subvariants, they may be more transmissible. But in terms of the severity and death risks, we don't have further information so far. For imported cases, we have relevant measures to prevent infections from spreading. But these measures will be taken after balancing other factors such as the economy, etc. For designated clinics, you may recall that we have 23 designated COVID clinics offering roughly 4,000 slots per day for COVID patients. As the local COVID situation is easing off, the demand has been dropping. For some designated clinics, some original services were suspended, such as evening clinic sessions and weekend clinic services. We will resume weekend clinic services and those in the evening. And then gradually, some designated COVID clinics will be converted back to GOPCs. But it will be done in an orderly manner because it's hard to predict where COVID will be going, whether there may be more cases after public holidays, and we will keep in view the demand, service for demand, etc., and make the relevant arrangements. We will announce any such arrangements when they are made, so that people will know when they can visit a GOPC. As for in-hospital services, at the height of the outbreak, half of our hospital beds were set aside for COVID patients. Over time, the number of COVID patients dropped. Some hospital beds have been receiving non-COVID patients. Apart from those admitted through the A&E, those suffering from strokes or heart diseases, we're also stepping up some non-emergency services for surgeries or for services like OGD, etc. or for day services for geriatric patients, we're also gradually resuming such services. As patients may need to go through screening before visiting the clinic, and they may have to do rapid antigen tests before coming to the hospital. Healthcare workers will remind people to do such tests so that they are aware of the infection risk and prevent situations where infection may happen in the hospital, and we appeal for public cooperation in this regard. Next question, we'll take a question in English.
A few questions from the SCMP. As today's caseload is the lowest since February 6th, since yesterday, so do you think that the fifth wave is about to end and we can return to normal life? And as non-Hong Kong residents are allowed to travel Hong Kong starting from today, has the CHP noticed a rise in incoming travelers? And are you worried that there will be a surge in imported cases or new variants emerging in the community? And the last question is, Professor Hui suggested that the government can cancel the flight suspension mechanism as there are enough protection from quarantine measures, adding that imported cases will not lead to a high risk of community outbreaks. Do you agree with him, and do you think the mechanism can be cancelled? Thank you.
I think the new measure has been implemented. The import measure has been implemented since today. So we have not. We expect there will maybe an increasing number of imported cases because of the increasing number of flights or passengers to Hong Kong. So the caseload has been decreasing since the peak in early March to 300 today, but we still have to observe because we have been slowly releasing the social distancing measures, and the increase in people flow and gathering may cause a rebound in the cases. So I have no comment on Professor Hui's comments.
下一位呢位女士。
係，醫生你好啊 ，TVB。
Next question, I'm from TVB. From today onwards, those on cargo flights can undergo on passenger flights can undergo 3 days of quarantine, and for those on cargo flights, they don't have to go through a quarantine. But what's the risk about the virus being transmitted through objects that have arrived in Hong Kong? And what's the risk? And is it a high risk for those as a result of this arrangement? Do you think they have to take a 4th shot of the vaccine? The risk of transmission through object. Such transmission has been reported in some places, but that is not a major source of transmission. Apart from objects, even for other situations when people touch facilities in the public, there's a risk, so they should maintain good personal hygiene and wash their hands. For the quarantine measures for aircrew members, these are measures based on the risk-based approach. Some aircrew members are under closed-loop management overseas, and in Hong Kong, they are subject to the test and hold arrangement. We'll take the last question. I'm from cable TV. From today onwards, we're relaxing border control measures so that non-Hong Kong residents can return to Hong Kong. How much of an increase do you expect in imported cases down the road? For non-Hong Kong residents and Hong Kong residents, the difference in imported cases should be comparable. But when you have more incoming flights and more people are coming back, there may be more imported cases. But it depends on the frequency of the flight and the number of people coming back. That concludes the press briefing today. Thank you.